A 2023 randomized controlled trial published in a Life journal tested 120 subjects with SI joint dysfunction aged between 30 to 60-year-old. They were divided in few groups with motor control exercises and balance training groups, and the results were this. So motor control group exercise and BT group saw greatest improvement with over 50% reduction in the pain, improvement in the movement and improvement in the quality of the life with more than 24 weeks. Today we are going to discuss how we can implement this 12 weeks protocol that is research based, and how we can do MCE motor control exercise and BT balance exercise training and combining to fix the SI joint issue for good. Hi there, my name is Rakesh and I'm a physiotherapist in Edmonton, Alberta. I have been seeing lower back chronic pain patients long time, and there are a few patterns that works really good, and here we are going to discuss that. First we are going to discuss the research part of it and how it was important, and then in the end stay in the video that I'll show you exact which exercise was done and what you can do for your back pain and SI joint dysfunction to alleviate your pain. So if you are struggling with this particular SI joint pain for a long time and you have this chronic issue and you're not able to fix it, maybe this can be the solution and this can be something you can do over the period of time. This clinical study that we are going to discuss has a good backing, as well as it confirms the previous study has a similar result as well. So 30% of the lower back pain are usually also the SI joint pain. What is SI joint? SI joint is a sacrum, which is your tailbone, and the ilium, which is the side of the hip bone. When they meet, they create sacroiliac joint. When it doesn't move properly, either it could be from injury, pregnancy, trauma, or sometime dysfunction, how you walk, stand or lift can cause this dysfunction. So how this study was done is 120 people were divided into 4 subgroups. One group with the motor control exercise, second group with the BT balance training, third group with combination of BT and MCE, and the last one was control group, which would be just regular management of the SI joint pain with 30 people in each group. So physiotherapist oversaw this program. So for the group 1, which had to do MC, was motor control exercise, had 3 phases over the 12 weeks of the period. How you do is, first phase is where you're going to control the abdominal and paraspinal muscle contractions. So this was taught by physiotherapists to individual patients. It's called abdominal indrawing maneuver, meaning you are contracting lumbar multifidus with the transverse abdominis, which is the core stabilizer muscle, to support the spine, and that's the phase 1. Phase 2 is where they added some sort of movement to the upper extremity or lower extremity to challenge it. And the phase 2 was functional activity with the control of these muscles. And this motor control exercise program was designed based on their client's efficacy or their capacity without increasing pain. Second group was the BT balance training group. This is not just the regular balance training. This was done in sitting, standing, prone, or on your 4 quadruped position in a different position with balance exercises. This was balance exercise with the eyes closed, eyes open, or some surface on the foam, or maybe bozu ball or something that can challenge your balance. Now, they ask them to hold that position as long as they can without increasing pain, and that was more challenging every time. Third group was the M plus BT, means motor control exercise plus balance training group, which did both of them, and the last group was the control group. They were provided with the regular stretches, movements, they knew about it, and they were educated. So mostly education was used in there. So the results were enormous and so much different between each group. After the 12 weeks follow-up, The results with the combined group where they did MCE and balance exercises sustained, and the other group or the standalone group didn't have the same result. However, they had improvement from the baseline, but they didn't have a similar improvement. So now the important part, how we are going to do this training. And also I have a little page where we can track week by week. So first of all, what we are going to do is the phase 1 of motor control exercise for the core and the back extensor group, which is lumbar multifidus. So first of all, the phase 1 is where you use the abdominal in drawing maneuver. And this maneuver is designed to activate the core muscle, but same time not move anything. So you try to do is you lay on your tummy comfortably, bend your knees and relax. And first of all, what we are going to do is we are going to bring the belly button in towards your tummy, in towards the floor, and you are going to hold that contraction. Here, physiotherapists noticed that there were some patients who were not doing breathing properly. So while we are tucking the tummy in or in drawing this maneuver, we need to make sure we have normal breathing pattern, that you're not holding the breath, and see if we can hold for 30 seconds. Once you are able to do this, you should notice some contraction in the tummy and some contraction in the lumbar multifidus, which is the back muscle. Now, once you are able to do this for 1 or 2 weeks, the next challenge is the phase 2, where we are going to do some combination of exercise where you will use some arm movements or some challenging motion while doing the motor control exercise. So you still keep the tummy tucked in, and we can add exercises where you lift the leg slowly and control the tummy and do the normal breathing as well, and continue with this, and then use the arms and add some more challenge. And with this, we want to still keep engaging the tummy, and then you can add more movement. Now this can be done in a different exercises, like a first called a bird dog exercise or a dead bug exercise, or you can just do while laying and doing some bridging exercise. Now once you are mastered with the phase 2, some people took 2 weeks, some people took 3 weeks. Again, it depends on your condition. Then phase 3 was introduced, which was functional exercises with using the motor control exercise. How do we do this is we tuck the tummy in and use that maneuver and doing normal breath. They were asked to do like a regular task, and doing a laundry or lifting something from the floor and putting back, and then using like a normal computer and still holding it. And longer you can hold it, you are able to engage those muscles better. Now this is a lot of information, but this is simplified with the stages, and then as long as you can pass one stage, you go to the next one. If you don't remember to contract your tummy while doing this exercise, means we need to go back. So this was done for over the 12 weeks of the period, and then they were assessed, and you can also do the same thing. Then the second exercise part was the balance training. Now for our exercise purpose, we want to combine both in the same day, because this was the third group who did the combination of both. How do we do is, this balance exercise was done in multiple positions. One in standing, second in quadruped, laying on your floor, and then also laying on the back. Balance training is all about challenging your core muscles or lumbar multifidus muscles. Now what they did is standing on the surface with both legs wide and eyes closed for 10 to 30 seconds, then add something like a foam or unstable surface and stand on it and try to balance again. The next level is on the same, is adding some movements of the upper extremity or some weight or 1 pound dumbbells to challenge it, and hold that position for at least 30 seconds to 2 minutes. Once you achieve certain time like 2 minutes of holding, you can progress to the next level. Same exercise can be done in the quadruped, where you're on your 4 hands and knees and you are lifting one of them and holding it with the core contraction, but same time you are balancing. You're balancing to the challenge to last for at least 2 minutes. And once you are achieving this, then you can add some challenge like putting a foam roller on it or a book on your back and holding that for at least 2 minutes, and then go to the next challenge. You can use some exercise ball or Bosu ball to challenge yourself. Now, this balance training was done also throughout that 12 weeks period, depending on how you're progressing. This is important that you don't feel the pain while doing exercise, because this will decrease the muscle activation and muscle coordination. So this is it. This is the whole program, and you can do these exercises step by step. And also check my other video out if you have a discogenic pain. This exercise will not work if you have a discogenic pain or a disc injury, because that is a completely separate monster. If you have a question regarding anything, let me know. If you need detailed explanation of any particular exercise, also comment. Thank you for watching. We'll see you in the next video.